So we are going to learn today about trauma. Now first we need to discuss what is the definition of a fracture. A fracture is the break in the structural continuity of the bone. It may be a crack or crumpling or splintering of cortex. The fracture can be divided further into a closed type and an open type of fracture. Open fractures are also known as compound fractures. In closed fractures, the skin is intact, while in open fractures, the skin has given way and it is not intact. This means the fracture fragments or the bone is in direct contact with the environment, which can lead to infection. Now, how do these fractures occur? The fractures can occur due to an injury or due to repetitive stress on the bone or abnormal weakening of the bone, which is seen in pathological fractures. Now we will focus on the injury part. What is an injury? It can be a sudden and excessive force which is applied to the bone. So what is injury? It is a sudden and excessive force applied to the bone or the part of the limb, you can say, which the bone will not be able to bear. Now this force can be applied in a direct fashion and an indirect fashion. When the force is directly applied to the bone breaks at the point of contact and soft tissue is also damaged. Depending upon the energy of trauma, the fracture can be a transverse type or it can be a butterfly fragment which imparts instability, or the fracture can be comminuted or in multiple fragments in a very high energy impact. The soft tissue gets crushed. Now in the indirect trauma, the bone breaks at a level which is distant from the site of impact. Twisting of the bone causes a spiral fracture. Compression of the bone causes a short oblique fracture. Bending of bone causes a butterfly fragment again, while tension in the bone causes a transverse fracture. Now we will discuss the displacement of the fracture. The fracture displaces due to the force which was initially applied by the injury, by gravity over the proximal and distal fragment of the fracture, and the pull of muscles which are attached to the proximal and distal part of the bone. What all type of displacements can occur? So majorly there are 4 types. First is translation. in which the bony fragments move sideways, forwards, or backwards, and the both ends are not in contact with each other. Only a part of the cortex is in contact, sufficient, so part of contact is lost or decreased. The second type of displacement is angulation or tilt, in which the bony fragments are lying at an angle to each other. This is the angle. If the bone heals in this position, then it will produce a deformity in the limb. The third type of displacement is rotation, in which the bony fragments are twisted along their longitudinal axis in different directions, and but clinically the limb will be lying in a different direction as compared to the normal side, and this produces a rotational deformity. The fourth type of displacement is change in the length, in which the overlap of bone will produce shortening, or if the fragments are distracted, then the length will increase, but it will lead to a non-union due to no contact between the fracture surfaces.